Okay, so now we know the two most common soft tissue injuries in the foot are deep distal flexor tendonitis and collateral desmopathy of the coffin joint, distal phalangeal joint. So can we distinguish between those two? Say we have a horse with a foot lameness that's been established with a palmodigital nerve block or abaxial sesamoid nerve block. We don't find anything on standard imaging techniques. We don't have MRI available. Can we get a feeling as to whether it's one soft tissue injury or the other that's causing the lameness? I'm not saying that radiographs can show you all the bony abnormalities. No way, but just let's pretend that that's the situation. Okay, so how do these two compare? Well, abaxial sesamoid anesthesia is not going to help us very much because both of these injuries will be 100% desensitized by this technique. A palmodigital nerve block is not going to help us very much because, again, the results are very similar between the two. This is from a later study. The earlier study suggested 63%, but we're in the same ballpark. Here comes the first difference. If we inject the coffin joint and the horse goes better, we're more likely to have a tendon lesion than collateral ligament lesions. And if we inject the bursa, the difference is very clear because a large proportion of tendon injuries will get better and none of the collateral ligament injuries should get better. The tendon sheath we don't really know, as I said, because we don't have a model of these injuries to test that on. So, I'd like to summarize what we've done so far in one way by looking at the list of things that are desensitized. First, when we block the palmodigital nerves, and you can just about make out from my list that there are 4 things that are desensitized: the coffin joint, the navicular apparatus, the toe region of the sole, and the heel region of the sole. That list gets shorter if we block the coffin joint, because we lose the heel region of the sole. The other 3 are still desensitized. And the list gets shorter still when we block the navicular bursa, because now we lose pain in the coffin joint. So 2 things are left: pain in the navicular apparatus and the toe region of the sole. Another way of looking at this is to break this down in a flow diagram, which you may have seen before. If you take this down in a flow diagram, going from least specific to most specific, then you can get a decision tree, as it were, built up like this. If a palmodigital nerve block is negative, but the abaxial sesamoid nerve block is positive, then we still have this list of possibilities as a cause of lameness. I've included the pastern joint, the fetlock joint, the digital sheath, pretty much everything around the fetlock and the pastern. I've also included the dorsal aspect of the distal phalanx and the dorsal laminae of the hoof wall, because remember, the dorsal branches of the palmodigital nerve are cutaneous only. However, what we're interested in is how the horses break down that are positive to a palmodigital nerve block. And depending on whether they're positive to coffin joint anesthesia, and then subsequently to bursal anesthesia, we can break those down in 4 groups, as I've already shown. If the horse is positive to a palmodigital nerve block and coffin joint anesthesia and bursal anesthesia, the pain has to be localized in the podotrochlear apparatus, which is the navicular bone and its ancillary structures, as well as the deep distal flexor tendon. But don't forget to use your hoof test, as I've stated before, because you will not be able to distinguish that necessarily on the back of a block from toe pain. If the coffin joint is positive but the bursa is negative, then the horse is most likely to have coffin joint pain. It may also still have deep flexor tendon pain, which is somewhat hard to understand, but there are horses out there, negative to a bursa but positive to a coffin joint, that have a lesion in the deep distal flexor tendon. Again, toe pain is there to murk the waters somewhat. If the coffin joint block is negative, remember there's still 1 in 5 horses that can be positive to a bursal block, which means they have navicular apparatus pain or toe pain. And then finally, when both coffin joint and bursa are negative, we're left with horses that are either suffering from undistinct heel pain or collateral ligament pain. And again, don't forget to use your hoof testers. So, I think I'll stop here, if that's okay. And if there are any questions, I'm glad to